Did you know that 1 in 9 men will be diagnosed with prostate cancer in their lifetime, and many will experience prostate problems long before a diagnosis? These issues often start with subtle symptoms that are easy to ignore, but catching them early can make all the difference. In this video, we'll explore the most common symptoms of prostate problems. Number 1, frequent urination. Frequent urination is one of the most common symptoms of prostate problems and is often the first noticeable sign that something may be wrong. This condition is typically caused by an enlarged prostate, also known as benign prostatic hyperplasia. As the prostate grows, it presses against the bladder and urethra, reducing the bladder's capacity to hold urine and creating a persistent urge to urinate, even when it's only partially full. This is particularly disruptive at night, a condition referred to as nocturia, which can severely affect sleep quality. Frequent urination isn't limited to benign prostatic hyperplasia. It can also be a symptom of other prostate-related issues like prostatitis, inflammation of the prostate, or in rarer cases, prostate cancer. Infections or irritation in the prostate can exacerbate this urgency by stimulating the bladder and urinary tract. If frequent urination is accompanied by pain, blood in the urine, or other unusual symptoms, it's essential to seek medical advice promptly. Early intervention can help manage the condition effectively, whether through lifestyle changes, medications, or more advanced treatments if necessary. Number 2, difficulty starting or stopping urination. Difficulty initiating or halting the flow of urine is a hallmark symptom of prostate problems. This issue often arises due to the prostate's location surrounding the urethra, the tube that carries urine from the bladder out of the body. When the prostate becomes enlarged, as in benign prostatic hyperplasia, it can compress the urethra, creating an obstruction that makes it challenging to begin urinating. This can lead to a sensation of straining or a delay before the urine stream starts. Similarly, stopping urination can also become problematic because the enlarged or inflamed prostate disrupts the normal coordination of bladder and sphincter muscles. This might result in a weak, intermittent flow or a sensation of incomplete voiding. In some cases, this symptom may indicate other prostate-related conditions, such as chronic prostatitis, which causes swelling and irritation, or even prostate cancer, where tumor growth can interfere with normal urinary function. Ignoring these symptoms can lead to complications like urinary retention, where the bladder doesn't empty completely, increasing the risk of infections or bladder stones. If you consistently experience difficulty starting or stopping urination, it's essential to consult a healthcare provider for an evaluation. Early diagnosis and treatment can prevent the condition from worsening and improve your quality of life. Number 3, painful or burning sensation during urination. A painful or burning sensation while urinating, also known as dysuria, is a common symptom of prostate problems. This discomfort often arises from inflammation or irritation of the prostate gland, urinary tract, or bladder. Prostatitis, an inflammation of the prostate, is one of the primary causes and can result from bacterial infections or chronic irritation. The pain may range from mild to severe and is usually accompanied by other urinary symptoms, such as frequency or urgency. Another potential cause of this symptom is benign prostatic hyperplasia. While benign prostatic hyperplasia is not typically associated with infections, the enlarged prostate can obstruct the urethra, leading to irritation and discomfort during urination. In more serious cases, painful urination may be linked to prostate cancer, which can affect surrounding tissues and nerves. Burning or pain during urination is often mistaken for a urinary tract infection, as the symptoms can overlap. However, in men, prostate issues are a common underlying cause of these symptoms. If this sensation persists, it's crucial to consult a healthcare provider to identify the cause. Early diagnosis can help address the problem effectively, whether through antibiotics for infection, anti-inflammatory medications, or further investigation for more serious conditions. Number 4, blood in urine or semen. When the prostate becomes enlarged or inflamed, as in benign prostatic hyperplasia, BPH, or prostatitis, nearby blood vessels can rupture, leading to blood in the urine. The blood may appear as a pinkish tint, visible streaks, or even microscopic amounts detectable only through laboratory testing. In some cases, hematuria may also indicate prostate cancer, where abnormal tissue growth damages blood vessels. Other potential causes include bladder or kidney issues, which a healthcare provider can investigate through imaging and urine analysis. Blood and semen is often associated with inflammation or infection of the prostate or seminal vesicles, as these glands are involved in semen production. Prostatitis is a common culprit, particularly in younger men, while older men should also be evaluated for potential malignancies. Although the presence of blood in semen can be unsettling, it is often benign, especially if it occurs only once or twice without other symptoms. Regardless of the cause, persistent or recurring blood in urine or semen warrants a thorough evaluation by a urologist. Diagnostic tests such as urinalysis, PSA blood tests, or imaging can help pinpoint the issue, enabling timely treatment to address the underlying condition and alleviate concerns. Number 5. Pain in the pelvic area or lower back. Pain in the pelvic area or lower back is a common symptom of prostate problems and can range from a mild ache to sharp, debilitating discomfort. This symptom is particularly associated with conditions like prostatitis, benign prostatic hyperplasia, or in more severe cases, prostate cancer. Prostatitis, an inflammation of the prostate gland, is a leading cause of pelvic discomfort. Acute bacterial prostatitis can cause sudden and intense pain in the pelvic region, often accompanied by fever, chills, and urinary issues. Chronic prostatitis or chronic pelvic pain syndrome, on the other hand, leads to persistent but less severe pain that may spread to the groin, perineum, or even the rectum. This discomfort often fluctuates in intensity and may worsen during urination or ejaculation. Pain in the lower back can sometimes indicate prostate enlargement or, in more serious cases, advanced prostate cancer. If prostate cancer spreads to nearby bones, such as the pelvis or spine, it can cause localized pain and stiffness. This pain is often deep and persistent, not relieved by rest, and may be accompanied by other systemic symptoms like fatigue or unintentional weight loss. If you experience persistent or unexplained pelvic or lower back pain, particularly if it's accompanied by other symptoms like urinary difficulties or blood in the urine, consult a healthcare provider. Number 6. Erectile dysfunction. Erectile dysfunction can be a symptom of prostate problems. While erectile dysfunction is often associated with aging or vascular issues, conditions like benign prostatic hyperplasia, prostatitis, or prostate cancer can also contribute to this issue. The prostate is closely linked to the reproductive system, and any inflammation, enlargement, or treatment targeting this gland can affect the nerves and blood vessels involved in erections. If you're experiencing erectile dysfunction along with other symptoms like urinary difficulties or pelvic pain, it's important to consult a healthcare provider. Number 7. Dribbling or incomplete bladder emptying. Dribbling, or the sensation of incomplete bladder emptying, is a common symptom of prostate problems, particularly benign prostatic hyperplasia. With an enlarged prostate, the urethra becomes compressed, disrupting the normal flow of urine. This can make it difficult for the bladder to fully expel urine, leading to the sensation that you still need to urinate even after finishing. Dribbling may also occur because the weakened bladder muscles struggle to push out the last bit of urine, resulting in leaks after urination. Over time, this incomplete emptying can increase the risk of urinary tract infections or bladder stones due to stagnant urine. This symptom can be both frustrating and embarrassing, as it may lead to frequent trips to the bathroom or the need to use incontinence pads. It may also disrupt sleep if the urge to urinate occurs frequently at night, nocturia. In severe cases, chronic incomplete bladder emptying can lead to urinary retention, a condition where the bladder is unable to empty at all, requiring emergency medical attention. Number 8. Reduced urine flow or pressure. A noticeable decrease in urine flow or pressure is a common symptom of prostate problems, particularly benign prostatic hyperplasia, or in some cases, prostate cancer. When the prostate becomes enlarged, the growing prostate compresses the urethra, which narrows the pathway for urine to flow from the bladder. This obstruction causes a weak or slow stream, making it harder to empty the bladder efficiently. Additionally, inflammation from conditions like prostatitis can irritate or swell the prostate, further reducing urine flow. In more advanced cases, such as prostate cancer, tumors can exert additional pressure on the urethra or surrounding tissues, exacerbating the issue. Reduced urine flow can be frustrating and may lead to prolonged bathroom visits as you struggle to fully empty your bladder. It can also increase the risk of complications, such as urinary retention or bladder infections due to stagnant urine. Over time, the bladder may become overworked, leading to additional symptoms like dribbling or frequent urination. Number 9. Urinary incontinence. Urinary incontinence, or the involuntary leakage of urine, is a common symptom of prostate problems and can significantly impact daily life. It often occurs in conditions like benign prostatic hyperplasia, prostatitis, or after treatments for prostate cancer, such as surgery or radiation therapy. In cases of benign prostatic hyperplasia, an enlarged prostate can exert pressure on the bladder, making it harder to control urination. This may lead to small leaks throughout the day or a sudden loss of urine when the urge to urinate becomes too strong. After prostate surgery, such as a prostatectomy, temporary incontinence is common due to weakened pelvic floor muscles or nerve damage during the procedure. In prostatitis, inflammation can irritate the bladder and urethra, leading to increased urgency and occasional leaks. Urinary incontinence can be physically uncomfortable and emotionally distressing, as it may cause embarrassment or limit social activities. Frequent leakage can also lead to skin irritation or infections if not managed properly. For some men, the fear of leakage during work or outings can affect confidence and overall quality of life. If you're experiencing urinary incontinence, it's important to consult a healthcare provider. Treatments often depend on the underlying cause and may include pelvic floor exercises, medications to relax the bladder or shrink the prostate. Number 10, fever and chills. Fever and chills are significant symptoms of acute prostatitis, a bacterial infection of the prostate gland that requires immediate medical attention. Acute bacterial prostatitis occurs when bacteria from the urinary tract, bladder, or urethra infect the prostate. This triggers a systemic immune response, leading to high fever, chills, and other flu-like symptoms. Alongside the fever, patients may experience pelvic pain, painful urination, or even urinary retention. Chronic prostatitis or chronic pelvic pain syndrome may occasionally cause low-grade fever, but it is less common and usually not as severe as in acute cases. Fever and chills paired with prostate symptoms should not be ignored, as untreated prostatitis can lead to complications like abscess formation in the prostate or even sepsis, a potentially life-threatening systemic infection. Severe cases may also cause nausea, vomiting, or an inability to urinate, which are medical emergencies requiring prompt treatment. If you experience fever and chills alongside urinary or pelvic symptoms, seek medical care immediately. Recognizing the symptoms of prostate problems early can make a significant difference in diagnosis and treatment outcomes. From frequent urination to more serious signs like blood in urine or fever, paying attention to your body's signals is crucial. If you experience any of these symptoms, consult a healthcare provider to address the issue promptly and protect your prostate health. If you found this video helpful, don't forget to like, subscribe, and share it with friends and family who might benefit from this information. And if you want more health tips, make sure to hit that notification bell so you never miss an update. Thank you for watching, and we'll see you in the next video.